Man, I've recorded this video so many times and just re-recorded it every single time from interruptions. But today's video is going to be about how to answer these interview questions. Now, this channel is mainly geared towards nursing, but this can be applied to anybody. My qualifications: I used to work for the state for about 10 years. I worked my way up to manager, and I've been on many interviews. Not because I didn't get the interviews, but because, well, when you go on interviews, you start to see a pattern, especially for the state. You start to know when they already have someone in mind, either through contacts in that unit that you're applying for, or just in the similarities of how the conversation goes. It's almost like you're wasting your time. Or when you ask for feedback from the manager after the interview and they don't contact you, or they have a really frivolous reason, like a really horrible reason for why you didn't get the job, like a reason that doesn't make sense, basically. I don't know if I'm using the word frivolous right in this moment. It's morning, I haven't had coffee, excuse me. But for example, I went on an interview, asked for feedback, I met with the manager. The reason she gave me was because she thought I was coached. She said I did terrific on the interview, but she just thought I was coached. She didn't know me at all, by the way, so I'm not sure how she thought I was coached. But as it turns out, when I saw the person that she actually did hire to fill that position, it was someone in my division that was up for promotion, so it kind of made sense. And I did wonderful on that interview, and I know I did, and you can sense and feel when you do wonderful. For my nurses, if you're applying for an acute care position, you will mainly get questions that have to do with that floor, the diseases or the chronic diseases that you may encounter on that floor. So if you're in med-surg, that's going to be COPD, that's going to be diabetes, that's going to be heart failure. There may be some surgery, or patients going to surgery and receiving from PACU. So you're going to want to know the treatment process for that. Study your labs. I remember one question I got was, what labs are you supposed to be looking for in a patient with heart failure? So study your labs, know what interventions are supposed to happen, how you're supposed to evaluate the patient, assess them, ADPI, basically. But for everything else, it's going to be situational and behavioral questions, and that's where I'm coming in with this video today. So, going for a state job, going for any job, here's what you may encounter and the best answers for them. So, the number one thing is to have a blurb, a 2 to 3 minute blurb describing your experience and how it links with that position that you're applying for. So if you're going to apply for an engineer and you had a job at McDonald's when you were 17, they don't want to hear about that. That doesn't apply to your engineering job, okay? They want to know how you were a rock star at the drive-thru. So make sure it's relevant to the position that you're applying for. Just 2 to 3 minutes of you selling yourself and your experience. So if you were a manager, say you were a manager of a 6-person team, that way they know how many people you have excelled at thus far in managing. If you were in customer service, let them know how many customers that you dealt with that day and how you increased sales or something like that. But basically 2 to 3 minutes, because most likely that will be the first question you are asked. Something along the lines of, tell us about your experience. Tell us why you would like to, or you applied for this position. Tell us how you qualify. Something along those lines, not the exact words. So you have to listen to these questions. Number 2, they may ask you something along the lines of how you deal with an irate customer or patient, just depending on what your position does and who you will be dealing with. So they may say an irate customer calls you and they're screaming and yelling. Basically, how do you deal with that person? Your answer needs to include tact. You will deal with them with tact, which means professionalism and not getting angry and remaining calm. You will listen, so that means you're not talking at the same time they're talking. You're going to listen to them thoroughly. Also mention you're going to remain calm. You're going to be empathetic. You're going to say, oh, I'm so sorry that this issue has not been resolved for you. I'm going to try my best to resolve this issue for you. I'm going to escalate it I'm going to work with my manager. Just kind of brief overview to help quell their anger, calm down their anger. So, and also put yourself in their shoes, what you would want done. You can think along those lines in the interview. What you would want done if you were that irate customer. You want a resolution. You want it quick, right? So you want to communicate with that person, with the customer every step of the way, letting them know that you're getting the issue worked on, when you plan to have it done, and when you will call them back. Those are important details for somebody that's upset to know. And then you will also follow up later on the resolution that you implemented to make sure that it's going well for that customer or patient. So include those key things. Number 2, they may ask you a question that's asking you the steps you would take to resolve an issue. This is a question that's surrounded or that needs to entail analytical steps. So in each field, there are analytical steps. If you're applying for the state, if you're applying for SSA, AGPA, managerial, they're asking for the 7 or 8 analytical steps. I don't know. The analytical steps may have grown since I've quit because it seemed like they just keep changing. But there are certain steps that remain the same. How you identify the issue, you gather data, you compare it to other things, you identify alternatives, you implement the decision, and you evaluate it later. It needs to include those details. Google analytical steps and you will find those steps. But you want to answer that question with an example from your own life, from another position. So with each step that you list, say what you did in that position that matches with that step. So if you identify the issue, say, I had an issue at my job and there was a customer or a member that called in and they were not eligible at the time. So what I did was I identified the issue. That included me going into our database and finding out that there was an incorrect number or an incorrect date placed in the member's file. So that's identifying the issue. Step 2, I gathered the details. I researched all of the databases and made sure that that was the incorrect date. Something along those lines. So just listen to that question. If it's asking for the steps you would take to resolve some type of issue, they're asking for analytical steps. For my nurses, that would be ADPI. You need to assess, you need to diagnose, you need to plan, you need to implement, and you need to evaluate what you implemented. So those would be the analytical steps for nursing. Now, another question that they will ask, prioritizing and analyzing. It will be something surrounding that. They will ask how you meet deadlines, how you have conflicting deadlines, something's due this date and so is this. How would you prioritize your work? Prioritizing and organizing. You need to identify ways from your past jobs that you organized your work. So did you use Excel? Did you use Access? Did you use some type of program or database to help you keep track of your deadlines and your work to make sure that you met all your deadlines? You want to say that. If it's something that's conflicting, like who the task came from. Like say you received a task from a director. It's due a month from now. Your first line manager also gave you a task. It's due tomorrow. How would you handle that? In most cases, you would go by who the task came from. In this case, the director needs the thing a month from now. So that doesn't take priority right now. If the director needed the thing on the same day that your first line manager needed it, then you would do the thing that the director is asking you to do because they are more priority than your manager, unfortunately. They can fire your manager and you, right? But since the director's thing is a month from now, you would take your manager's thing because it's due tomorrow, right? So it depends. You want to make sure that you mention who is the request coming from, the dates, the deadlines that it can be done in, and if it's due on the same time, you would notify your manager that you received something from the director and you would get it done as soon as you can, or you can tag in another person to see if they're available to assist. Delegate. In nursing, we delegate. but in other positions, they may see that as a flaw because you're asking someone else, but that is a choice. You can say that you would see if there's another person available to assist you with that and delegate and work together. But other than that, those would be the answers that you would give. Another question you may get: name a time that you didn't know what to do and how you resolved that issue. They want to see that you're resourceful. Don't automatically say, I would ask my manager, or I would ask someone else to do it for me, or that you would ask someone. It depends on how the question is structured, because part of that is you want to utilize your resources. So you want to utilize any manuals, any policies and procedures. You always want to consult your policies and procedures. That is key. So mention that somewhere in your interview and you will get accolades for that. You'll get a lot more points for that. But they want to know that you're resourceful and capable of handling things without always going to the manager or asking someone. But sometimes you build up a relationship with other people in other units, and you can use those resources. But the manager wants to know that you're not always going to be on their butts about things. Like, you're not going to be totally asking them and relying on them all the time. So you can say that you would use your resources, which may include contacts that you and relationships that you have built, because you're good at that. Mention that. Again, consulting all manuals, training manuals, policies, procedures, guidelines. That's key. Or a specific trainer who trained you, right? So those are all viable and good answers. Another question is where you want to be in 5 years. So this is a tricky question. They don't want to hear, well, I want to be the president of the United States, or I want to be the director of the whole company, or, they don't want to feel threatened by you. Everybody has an ego. So one of the best answers to give is to say, I don't intend to become the director of the company or anything like that. If you see yourself in management, go ahead and mention that. But say that your main goal is to grow and learn professionally and to get to know the company and to support and uphold the mission and the vision and see where that takes you. If it is management, then you would be great. You would be a great fit for that. But you're looking to learn, grow, and that's basically what you're learning, what you're trying to do. That's a good answer. They want to know that you are flexible, that you are easy to work with, and that you're just a person that's open to growing. So that's a good answer. There's another question that kind of plays off of the irate customer or patient. Conflict with a team member or a manager. How would you handle that? And these questions aren't going to be just that. You have to listen to the questions and to see what the underlying thing that they're trying to get from you is. So there's questions that have to do with how you would resolve an issue with a team member, or you disagree with the manager. How do you go about handling that? The number one thing is to not embarrass them. So you would want to pull them aside, maybe to a conference room, and you want to tell them the issue in a calm manner, always calm, and hear their side, and maybe work out a plan or a resolution that can suit both of you in a cordial manner. If it's not cordial, let's say the other person's irate, then ask if you can or get the manager involved or a third party involved who will see both sides without emotions involved and resolve that issue. So together. So those are good answers to have as well. You also may encounter a question about when you did something wrong. So when you did something wrong, name the steps you took to resolve that. They're looking for an answer that says, I'm accountable, I take accountability, I don't blame, and I resolve the issue. I learn and I grow. So basic overview with that question, include those keywords. I also advise you to know the company's goals and missions or vision before you go in. This is good to plug in at the end of the interview. Say, I understand that your company's goal or mission is to blah, 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 blah. I'm someone that can totally back that mission. Here's what I've done in the past that supports that. And they will be wowed by that. Have a closing statement ready. Something that sells yourself within 2 minutes. And also have examples. For each and every question, have examples. Not long-winded, but something basic and overview that they can understand, and you will ace this interview. These are my tips. And believe me, if you're applying for the state, they do have a list of keywords that they want you to hit and say with each question. I know it, and I have it. I had it. But yes, take this advice, and you will most likely ace that interview. Another thing that you want to have is at least 2 questions locked and loaded. You can Google these types of questions to see, good questions to ask your interviewers on an interview. But one thing that I always ask is, how has your experience been working within the department? Maybe you want to ask how is training done? What can you expect during training? Those are good questions to ask. And then when they ask again, after they answer that, do you have any questions for us? It's a good time to jump in with your little blurb of selling yourself. 2 minutes tops. Okay, how you would be a perfect fit, and thank you. And end with thank you for taking the time to interview me, and I hope you find your ideal candidate. Shake hands, send a thank you letter afterwards via email. This is for anybody in general. These are the types of questions and the situations and behaviors that they're looking for you to say, the answers that they're looking for. Good luck on your interviews. I'm sorry that I'm not all polished and made up, but this is me, and I'm just here to try to give information. I'm not here to try to be the next YouTube influencer or superstar or IG model, so whatever. If you don't like the way I look, you can clearly click off. I don't give a shit. But I do give a shit if you get this job, so yeah. Good luck to you. As I've mentioned before, I've helped other people get jobs even in positions above me when I worked for the state. It's a thankless job, but I like to see people grow and get to where they want to go. So yeah, hopefully you enjoyed this video. Please like and subscribe if you like the content, and good luck to you. Bye.